and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to talk about some community prevention programs designed to help our youth primarily, but others in our community as well, stay healthy and provide some risk reductions. My guest is from the Community Services Board, Nikki Bacilia-High. Welcome.
Thank you.
It's interesting to talk about prevention because it's sort of, in some ways, hard to measure what you do. Yes. Because when you prevent something from happening, you kind of can't count it. But you are a very data-driven organization, and you look at what the risks are and where the dangers are and try to reduce the numbers of people falling into those categories.
Yes, we in Prevention Services, we work towards the reduction of alcohol, tobacco, and other drug abuse in the community. And we also work on promoting mental health.
And so you've looked at our community, and I'm going to, because you serve both localities, Hampton and Newport News, our community is the combined community, and
Correct.
They're probably not all that different. So what are the biggest risks right now for our community, especially our young folks?
Yes, we are data-driven, so we've looked at some of the local, regional, and state data. And currently, our priorities for prevention include tobacco prevention, substance abuse in terms of the opioid crisis, and suicide prevention and mental health promotion.
Wow, okay. I'm going to take each one of these a little bit because tobacco, it just throws me. Like, I know I'm an old person, but I went through this and went through it with my kids. And, you know, we kind of reduced the amount of smoking. I mean, I remember getting my parents to quit smoking because they taught me this stuff in school. Like I was, you know, my generation was kind of that poster generation where we didn't smoke and smoking was outlawed in buildings and, you know, the workplace. And we thought we were kind of winning that war.
Yes.
What happened, Nikki?
We thought that we were winning that war. And of course, the electronic cigarette. So our young people are vaping. And so 78% of high schoolers are currently using electronic cigarettes.
78? Wow. Mm-hmm. Wow. How did this happen?
I think it's the perception that it is not harmful, that the electronic cigarette is a healthy alternative to cigarette.
And I think that came about because if you're trying to quit the actual cigarettes, it is healthier. It's not healthy. And none of it is healthy for young people, right? What does nicotine do?
Well, our young people believe that it's not as harmful, and their brain really doesn't finish developing until they're 25. So the chances of a young person becoming addicted to nicotine increases if they start using prior to their adolescent years. Also, they're being targeted with flavor. Electronic cigarette come in different flavors, candy flavors, cotton candy, for example, bubble gum. So those things are attractive to our younger people.
So how do we change that message? You're the one who's out there, you're on the forefront. How do you explain this to them? Because, you know, young people aren't really notorious for listening to the facts when spoken to by an adult.
So currently we do educational programs. We enter school, life skills training, for example, or we also do attend community health fairs and bring out information so that they're aware of the harms of the electronic cigarette, for example. Juuling, we have done some promotions just trying to educate young people on the harmful effects of the electronic cigarette.
Do you think we're making gains?
I think we're making gains. They're listening. So we typically partner with young people through our Community Builders Network Coalition, and we have some sharp young people who are willing to bring this issue to their peers and want to help us educate the community and their peers about the harms of vaping.
That's great. And can we learn from the campaigns, you know, that helped get people to stop smoking? I mean, one of those was the cost. For gosh sakes, the Juul, that costs a lot of money. People are, you know, and you don't just do it once or twice. Once you become addicted to nicotine, you've locked yourself into that long-term spending that, could buy a whole lot of other wonderful things, like a college education. No, not entirely, but you know, at least your books. You're spending your textbooks worth of money each year on juuling or vaping or whatever, you know, format it is you use.
Correct. We try to educate young people about the cost and the effects to their health also.
They think they're immune. They don't believe they'll get addicted. They don't believe it'll actually hurt them. There's something about being young that just
make us invincible.
It is. It's hard. But you're out there fighting that. Okay, so tobacco, you said, was one. Let's talk about opioids, because we're just increasing in the intensity and danger level here.
Definitely. On the prevention side, we currently have a campaign to bring awareness to the community. You can visit our website at vastop.org, and you can get information on what it is and some of the prevention methods that other people can do to educate themselves and their families about the opioid crisis. We also have some public service announcements that are airing at the movie theater here at the Cinema 24 in Hampton and the Regal Theaters. And they just bring some awareness and education to the community about the harms of the opioid crisis.
What are the biggest risks of the of using an opioid?
Well, addiction, of course.
Immediate. I mean, it's like
yes.
You don't mess around. It might take a little bit to get addicted to some substances, but that one, it's almost first use, right?
Correct. Mm-hmm.
I can't even imagine. Mm-hmm. And what's another risk?
Oh, another risk.
Overdose. I mean, you don't know what you're getting, yes. And it could be whatever. It could be heroin. It could be fentanyl. It could be so potent that you could die immediately.
Definitely, overdose
it's so scary.
Big risk of the opioid crisis. Fatal overdose. Mm-hmm.
And I think, as a society, there's been this period of time when we didn't understand what was happening, and people who had legitimate prescriptions became addicted, and we have to deal with that. But now we know what's going on, and the message should be out there. Are people listening? I mean, now that people know, people who aren't yet addicted, are they paying attention?
We hope that they're paying attention. We, through our promotion of our campaign, we're trying to send the message that it could be anyone. Anyone can become addictive. So we hope that our campaign is having an impact with the reduction of the opioid crisis.
What do we see locally? Is there a profile of someone who is addicted or is likely to become addicted, or is this one just really pretty widespread across the spectrum?
It's pretty widespread. And like our campaign says, it could be anyone.
I think that, it's true certainly of what you've seen in the news. It could be rich or poor or white or black or really any age.
Any age.
I mean, that's, I think, what has been astonishing is there are drugs that spread through young people. There are drugs but this one is just, it's kind of across the board. And I think it's because of that prescription drug initial usage sometimes. It didn't start out necessarily as a street drug, and anyone.
It could have started out after surgery, having a prescription because of pain, and it could become a problem. And so our campaign aims to educate the community about the risk.
Yeah, it's been tough, and because so many people have already started down that path, it's going to stay difficult for a while. But the key thing, I think, is to not let more people
and not get started.
Mm-hmm.
Yes.
So you're watching those numbers.
We're watching those numbers.
Okay.
Definitely.
Suicide is a hard one. I think that's just so hard to talk about because those peak years there are kids and our young adults.
Yes. For Virginia, suicide is the 11th leading cause of death, but the second leading cause for ages between 15 and 34. And so we are having a campaign to promote and educate the community on mental health and depression. We provide mental health first aid training classes, which we offer through our prevention program.
Okay, that's
for free.
fascinating. Mm-hmm. Tell me what mental health first aid is. I love that term.
Mental Health First Aid is a class that it's helping to bring that awareness to the community about what the signs may be for depression and suicide, to be able to identify, to be able to reduce some of the stigma that comes along with mental health.
Is the stigma still pretty strong out there?
Stigma is still strong. However, we hope that through our training in Mental Health First Aid, we are able to reduce a lot of that stigma.
I think it's especially strong in our young men. They think they're like supposed to be able to deal with things on their own, and they're tough, and it's hard to ask for help, or it's hard to admit vulnerability or weakness or whatever that might be.
Definitely. We see that it cuts across all age groups and all cultures.
So how do we prevent suicide? How do we get people to reach out? How do we normalize asking for help?
Well, hopefully through training and awareness and learning to identify those signs, we can help people be more apt to reach out for help.
Are there statistics about how many people, about how widespread it is, how many people who've considered, or how many people who have faced depression sometime in their life? I mean, it's not this tiny little number of people who actually kill themselves. It's a much bigger phenomenon, right?
Yes, currently I don't have those statistic numbers with me, but I know it's the second leading cause of death for people between the ages of 15 and 34.
And there's trend numbers too, where when someone commits suicide in a small community or group of people, it begins to look like a solution, and it can spiral, and other people can, that can be like a copycat or a trend thing. It can be a really horribly devastating thing for an entire community.
And that's why we hope to educate our young people to be able to identify signs, to be able to reach out for help, and to know where they can go for help.
So tell me again how you get this word out, because this is a tough job.
So through our prevention services, we partner with our community partners. Part of getting positive outcomes in our community is to have partnership with youth-serving organizations, faith-based organizations, with some of our schools, and some of our great partners, Alternatives, which is another youth-serving organization. So we partner a lot with them to do some of our programs.
And that's good too, because a lot of times then you're getting the youth leadership to talk to other youth. And I think sometimes that age group listens to not sometimes, there's statistics that back that up. They listen to their peers more than they listen to us at that point. That's just who they are and where they are.
Definitely. And also we serve our families. We provide a Strengthening Families program where we also try to reach families and help communication between families, so that we hope to reduce some of those problems that we have and produce some positive outcomes in the community.
So if people are listening out there and want to help, or want to get help, or want to help you spread this message, Nikki, what should they do?
They can reach us through our Hampton-Newport News Community Services Board website.
Okay, and we'll put that up on the screen.
Definitely.
And what other messages do you have, or what other areas of concern after the big top three might there be?
Well, we're watching. We continue to watch alcohol, underage drinking, because it's still one of those substances that are still abused by our youth.
And easier to get.
And we continue to promote mental health.
Yes. Huge topic. Even if you're not at the point of suicide, there's a whole lot in terms of getting there and straightening things out and living a healthier life so you don't get to that point. So thank you.
Thank you.
All right. Well, thank you very much for all you do, and we appreciate this lesson. And it's been a nice deep dive into what the biggest concerns are in our community, data-driven, and how we're looking to reduce that. Thank you.
Thank you for having me.
And thank you for watching. I hope you have learned a little bit more about some of the big problems in our community, and you understand how you can help reduce risk and spread this message as well. Thanks for watching.